Hello, St. Lucia, and thank you so much for tuning into this broadcast. We're bringing you a very important update, and we're discussing COVID-19 as St. Lucia continues to manage the fourth wave of COVID-19. In studio with us for this update, members of the National Council on Public Transportation, the NCOPT. I am Lucia Joseph, and we'll be discussing the recent minibus sector. We know we have some positive cases, quite a number of positive cases of COVID-19 within the public transportation sector. The members of the Executive Council will be discussing those issues and possible actions that will be taken to protect their members and as well members of the public. In studio with us is the first Vice President of the NCOPT, is Mr. Kentry Frederick. Spencer McPhee, who is a treasurer, or trustee rather, and Demetrius, the treasurer on the executive of the NCOPT. Gentlemen, welcome. Thank you so much for making this urgent call to the GIS so that we can share this information with the wider public. Let's begin with you, Mr. First Vice President Kentry Frederick. We have heard of the announcement, or certainly the news circulating, that members of the public transportation sector have been tested positive for COVID-19. Can you just give us some detail on this latest development?
Good afternoon, St. Lucia. Good afternoon, Lisa. It's always a pleasure to have your doors open to us and then to be in studio to give out the correct information, because without the absence of that information, we are left to speculate, and sometimes it could be even more detrimental to us. Rightfully said, as we speak, we have 5 confirmed cases of operators who are infected. We had 6. Unfortunately, day before, 1 passed away. There is 1 that is in critical care and another which is in serious condition. So what we did is to have dialogue with the Ministry of Health, officials from the Ministry of Health, and also the Route Association to sensitize the other operators and then to take preventative measures to avoid further disruption. And also today the Executive Council met and we discussed many of those issues that we'll be discussing further as we go along today in terms of the situation at hand. But it is true that we have some operators who are infected with the virus at this time.
Now, of these confirmed cases, operators all on one route?
Absolutely not. Many different routes.
How many routes have been affected by this?
5 routes.
So 5 routes, so it's a confirmed case for each route?
Yes.
Routes?
Right, but 5 operators, yes.
So in terms of the discussions that you've had with the Ministry of Welfareness and Elderly Affairs, especially particularly the Chief Medical Officer and her team, the contact tracing team, etc., what have been the discussions at that level, and what has been the advice that has been given to the executive?
Last week, Monday, there was a meeting with the COVID Command Center, which is of a number of persons all across the board. And what we recognized that there was a call for reduction in the number of passengers per minibus. However, within the walls of council and other persons would have noted, prior to this wave, we were allowed to have 3 persons per row of seat, and the numbers were down. So which means that is not the problem, the main problem. The main problem, which brings us to that, is human behavior across the board. Hence the reason why we believe it is necessary that persons should understand the protocols that were set in place, and we wrote a physical letter to every association island-wide to get in that you sanitize your bus, you sanitize your hand upon entry and exit upon transaction with cash, reduce talking during commute, and I will get to that a little later. Also, the wearing of masks both by passenger and driver. It makes a difference. So the main issue is not just the reduction in the number of the bus, but the human behavior on the bus.
But certainly the reduction in the numbers would lend itself to being able to allow the passengers to have enough distance between them on an enclosed space. Would you agree with that?
Not necessarily. Not necessarily. Part of the problem in terms of the spread, if I may, does not only happen on a minibus. And that is why at our meeting I explained to some persons, we need to understand, if you walk into a supermarket, you choose a bottle of water, you take it along with you. Do not be touching many different bottles of water. So you see with your eyes, but you only touch with your hands. If you go to the bakery, you choose a loaf of bread and go with that one. You still have bakeries, supermarket persons touching how many different items and only taking one. This is also contributing to the spread. However, human behavior in terms of sanitizing and all of that contribute towards that more than persons being in proximity of one another. We know that for sure.
So in terms of, before we get across to Spencer McPhee, the agreement reached at that meeting, at the command center meeting with the association, what were some of the agreements that you came to?
We went along with what we had when the numbers were reduced.
That is going to remain.
It will remain, because the cry is for reduce the number of passengers. This is not the main problem. Human behavior in terms of, for example, we knew that during St. Lucia have two main topics that are usually heated: religion and politics. And we are saying, yes, no matter who you support politically, or no matter who you attend to religiously, right? Please control the talking. A commute from here, from VG to Castries, why should there be so much talking? Because there is a reason why we try to do that. We're not saying you don't talk on a bus, but try to reduce and all of that. So if we were to go with it, and I must say, the Ministry of Health and all other persons involved, the police and all of that involved in the COVID command center, they do understand, and we work as a team in terms of just straight out discussions. So it's not a case where we are at odds with one another in terms of understanding what is happening. But the main emphasis is to protect the general public, at the same time allowing the minibus operators, which were under pressure from the 15th of March last year, to pay their loans, survive just as anybody else. Because the minibus operators, they have done well being under so much pressure for over a year. So we have to look at both sides of the coins.
So let me ask you, Spencer, in terms of being able to have these protocols, because as Kenji was saying, that it's really human behavior that is driving this pandemic. What is the feel now from the members of the association now that you've had a member who's died, one in critical care, another who's in serious condition as a result of COVID-19, an overall infection there of 5 individuals being infected with COVID-19. So what is the feel from your members at this point?
Good day, Lisa. Good day, St. Lucia. And I want to thank NTN for affording us this opportunity. We are hoping that at least they will revisit the thinking of the vaccine. I mean, we're not imposing on anybody, but we're hoping even more enforcement of the protocols, like Mr. Frederick said earlier, looking at the wearing of mask, sanitizing, less talking on the bus, things of that nature. I'm pretty certain a lot of waiters will rethink the way they used to think before. We've heard commuters saying, for example, that COVID doesn't exist. And maybe operators might have been of that opinion to an extent too. So the unfortunate death of this gentleman, we hope it will shed some light. It will make them rethink the way they operate and the way they do things. Yeah.
And because, we often place a lot of emphasis on the operators, but it would seem that the operators are often under pressure by commuters to be able to accede to what they want. Driver, I'm stopping here, and they want it that they're stopping right where they say to stop. And so it would seem that sometimes the bus drivers themselves feel a little powerless in being able to deal with members of the public. So in terms of being able to give that support to the members by way of perhaps a conductor on the bus, perhaps when you are queuing to enter a minibus on the bus stand, what sort of support is being given there? Any one of you can take that. Demetrius?
Well, good afternoon, first of all. One thing I'd like to say is to the public is that we would like you to adhere to the protocols. It is very important to us that you adhere to the protocols. We cannot do it on our own. We need the public support that we can do this and to do it the right way. Without the public support, the council and the minibus sector move forward, and for us to go through this pandemic and make it happen. We need your support 110% so we can make this happen.
Right. So in terms of the support, what has been the discussions at the executive level on how you can help the minibus operators have the commuters follow the protocols, they themselves are being able to follow the protocols?
We've had a number of discussions, even with the public. When we've had meetings, we've invited the public. Currently, even the public has come up with suggestions. You need to have hand sanitizing machines on the bus. You need to sanitize your bus. Actually, at the meeting today, we had discussions with a number of persons as to how we're going to go about sanitizing the buses, on what hours, during the hours, how many times we're going to sanitize those buses for the week. So there's a number of ongoing discussion because, as we all know, the pandemic, it is very dynamic. Things can change within hours. So we are currently talking with a number of sanitizing companies to discuss how we're going to sanitize these buses in case we have an emergency where somebody has turned out to be positive. How do we take those buses off the routes, and where do we drop those buses? So a number of discussion has been going on as to find out what is the way forward and how do we go about this.
You wanted to add, Spencer?
Yes, Lisa. I need to make the fundamental point that it's not because of unfortunate death we are active. Pre-COVID, we met with stakeholders, the CEO, the Ministry of Health, and we had a number of meetings, and we zoned the different routes. So we've been having a lot of pre-COVID from last year, even before we had one case in St. Lucia. So we did not wait until probably a death or a driver get infected to have made the move we're making now, or to be preaching to people. Yeah.
How do you support the protocols? We know that the hand sanitizers, all the things come at an expense. So are the associations themselves responsible, or what support are the associations receiving from the executive level?
Lisa, last year when COVID started, the impact of COVID, we approached a number of individuals, corporate citizens, private enterprises, persons who rose to the occasion. And we got, some associations, I must say, got certain donations. I'm not into the political side of it, but I have to be fair in my statement. There were parliamentary representatives from one or two places that gave donations in terms of the hand sanitizing machines, one or two, and even some bottles of hand sanitizers. But the pandemic continue. We must begin to think of other ways that we can support the system. And we need persons to understand that reducing the number of passengers on the bus, that's not a cure. Because the drivers still have the same obligations that he had, including the insurance, the premium. Second to that, there are persons who are generally more inclined to good hygiene than others. So they work with the sanitizers. So you're sharing a cake, but at the same time, you can also give somebody a piece of the pie. Because if you notice the driver is a bit low on sanitizer, you can say, okay, just use mine. We are each other's keeper in this pandemic. So you cannot say because you're from Grosley and the driver is from Viewfort, let him do what he wants. Look at the matrix. Somebody who's coming from Soufrière takes a bus from Soufrière to Viewfort, which is 4F, Route 4F. When he gets to Viewfort, he walks across, take a 2H bus from Castries to Viewfort, walk across Castries, and takes a 1A bus from Castries to Grosley. This individual have boarded 3 buses. And if you look at a 14-seater, well now most of them 13, 14, 2 less, have come into contact with 14 times 3, I think that's 42, thereabout, just in one route. On the return leg, chances are you may not travel with the same person. So look at how quick this thing can spread. So what we're saying, we are making an effort. We want to give the service. However, we need the general public to cooperate with us. We need them to understand it is not about money. Truth be told, no minibus operator at this time is actually making a profit to talk about. But if we were to say we are not providing the service, then the minibus drivers are greedy, they are on strike. We are not towards that. We want to give the service, but we want to protect our family and we want to protect our investment, also assisting in the building of the nation and the sustainability of our economy at this time.
All right. So let's talk about the affected routes. So there are 4 affected routes.
Sure.
The names of these routes are not being disclosed. Can you tell us the thinking behind that decision?
Okay, the thinking behind that decision is one of discrimination depending on how mature you are. The reality of it is that we are taking all precautions as we did this morning. There were 2 particular route operators, the minute they felt differently, they called in and we are making arrangements to deep steam clean these buses, so they have not been at work. The others, we spoke to individuals this morning and they went to do the testing and we're doing our normal day-to-day in-house thing in terms of the symptoms and contact tracing along with the Ministry of Health. So as this is happening, if the worst case scenario that all of this up now to be positive, we now have to engage, because there was discussion with the Ministry of Transport this morning to look at replacing, in the worst case scenario, if all of them are infected, you have to make an amendment to the route structure at the Ministry of Transport level to get other buses from other routes that are okay to serve the commuting public. So behind the scenes, we are looking at all of that on the table in the event the Ministry of Health come back and say, okay, those drivers from that particular route, they are all positive. Obviously, they would have to go into isolation for 14 days or more as may prescribe, but we still have to give the service.
Okay, so let's just break it down and make it clear for members of the public. 4 affected routes.
Sure.
all of the drivers on these routes are being tested or have been tested?
In the process of being.
In the process of being tested,
will
which
be
is
tested.
why at this time the discussions are being had with regard to the eventuality, if they were to be positive, how that service can continue. And so we're not disclosing the routes. So how do people know, for the commuters? For example, if I were to have taken a bus, how do I know that it is not that particular bus or that particular route that is affected?
The buses in question, none of them are on the route. They are all.
And they were taken off route when?
As the first two, as soon as the operators felt a little different.
But you don't have a time frame for that?
Same day.
Or the same day?
The same day.
Same day.
The same day. And they called in and he said, look, I'm not feeling okay. I'm not even sure if it's COVID or just a flu or anything, but I packed my bus. I need NCOPT to look at the sanitizing, the deep steam cleaning and all of that. So we spoke to the gentleman providing the service, and that will be done. It can be done in two ways. He come to your compound, the bus, steam it, then disinfect it and all of that, or the bus can be taken to him. So even the bus being taken to him, there is a procedure in which we follow. Now, when the bus is sanitized, it's clean, and it is declared safe, normally there would be a 14-day period for you to get a new driver to come on. But we understand the plight, the financial implications. So what we would do at the Executive of Council level is to work with the association. If there is a driver within the association that can work for that individual, we would allow that to happen while we are trying to see if the person can get back to non-health. So we have a lot of little measures in place behind the scenes to try as much as possible to sustain the system. So it's not just about the money in the system, but the service being provided. Because you will well understand if we say, okay, people to Castries cannot work, by 4 o'clock, Castries will be in a mess. And unlike any other route. So on any given day, we move hundreds and thousands of persons all over. So we're trying to do it with minimal disruption. However, we are using the prescribed method to ensure that the bus affected is secure, and also the drivers are taking the best practice in that regard.
So we have the unknowns, but in the known cases, for the confirmed cases with the operators, how are you contacting commuters? Because we don't know the routes. So how are commuters being contacted in all of this contact tracing process? How is that happening? Because this must be a monumental task.
It is. I think yesterday when I spoke with Doc, and just when you begin to think of it, it's scary. But we cannot hold the information hoping that all is well. It's like looking at the mountain, it's going to rain, but remember it started raining the mountain before. This is just the harsh reality. And there is no need to panic, because it is better for us to give that information so that persons are aware that there are bus routes that are affected.
But then they don't know the bus route. So
right.
In effect, we're not quite sure how to go about as commuters, as members of the public, to begin. We'll follow the protocols. But in terms of knowing that perhaps if it is the route that's going to Charlottesville, for example, and I'm a resident of Charlottesville, I take the bus daily, I need to know whether I am at risk or not. So it's very difficult for members of the to be able to even contact the authorities and say, well, listen, I traveled, I'm on this route, perhaps let me know the number of the bus. So is that what the procedure is? How do we know?
We learned from our mistakes last year. If you recall, there was a bus from the Route 2H last year when the gentleman fell in. The pandemonium, the uncertainty on, I witnessed being on the bus stand because I don't always like to drive from Castries to Viewfort. And when I got there, I'm literally seeing persons looking down at the number plate, and there are other operators who look like him. And they will say, "Are you so-and-so?" Which it can be a little discriminatory. So much as all of this was happening, the bus was already off the route. So we learned that do this because the bus that you are concerned about is not on the route. So all you need to do, if you are using the bus to and from work, otherwise, just follow the protocols. Because St. Lucia is a small community. And I am sure before we leave the studio, somebody from one of those communities would have said to you, "Lisa, you know, a driver died in my community or 2 drivers are not on the route, so I suspect." But we have to give this kind of guidance to persons is just follow the protocols. Reduce the talking. The buses in question, they are not on the route at this time. However, you may have traveled on one of those buses previously and are now traveling on another bus. So as a member of the commuting public, you realize you pass and somebody has some onions and you don't smell the onions, you need to begin to check the Ministry of Health.
And so individuals must be very, very vigilant and make sure that they pay attention to changes in their bodies, making sure that, you know, do you feel a fever coming on, do you have a persistent headache, and just develop a cough or any sort of vomiting, you would need to be able to call your healthcare provider on that. And then I think I belabor the point because also want to home the fact that COVID-19 is everywhere. And even though you may know what that route is, you may want to put up your guard when you go into Charlottesville, for example. But when you go
in Brown City,
yes,
you let it
down.
Yeah,
exactly. When you go into Brown City, then you want to be all relaxed. But no, the threat is everywhere, and that is the important point to always remember.
Yes.
So, Spencer, you wanted to
Yes, Lisa. I just want to expand on what, my Vice President said. We were discussing this morning, one of the discussions that came up, and we are thinking of designing a database for the buses that will be sanitized. So it will be kept with the President as well and National Council. So we can do follow-ups that these buses was clean on so-and-so date, we can follow up. So we'll be designing some database for the sanitizing of buses as well.
Okay, and that's going to help tremendously.
Yeah.
What about a database for the passengers? Is that at all possible that when you have individuals coming in that you can perhaps record the name of this individual? Is it possible?
This is something we've discussed time and time again. But remember, human rights, people rights.
Yes, we don't want to infringe.
You're bordering on that. And this can be ticklish. Up to this morning, we discussed it. And it's something you have to give careful thought. And we need to try to find the right way to go about it, because just about everybody has rights now, and you have to be careful how we go about it, that we don't end up in the court or we are challenged. But it's something we've been thinking from since last year, to have a database and, or even a clipboard that when you come in, you write your name or something.
So what about the enforcement? How do you plan on doing this? Because even though we have this very scary situation going and very tragic to have lost a member and to have other members so critically ill, you will always find those individuals who would not want to comply. How are you planning on ensuring that the protocols are enforced at this time? Well,
the time has come for us to act. And we will act one way or the other, because we are at a critical stage where a life has been lost. So at this moment, we are in discussion how best to go about it, if disciplinary action is to be taken or whatever has to be done.
Okay. And just, Demetrius, talk to us about the sort of discussions that the executive would have had over a time period in being able to bring what sort of relief that you've been able to assist your members with over this COVID period.
For Routes Association, the National Council on Public Transport, are currently in discussion in terms of what relief as to, in terms of payments, they would like us to waiver. So we are looking at that. Some we have already started doing it for. On an association level, however, we've had countless discussions with the association to advise them as to maybe you all need to waiver the fees, certain fees to a certain percentage as to we can move forward. A number of association has already done that, and to try to alleviate and ease up for the minibus driver and the sector as a whole. As we were well, with the previous administration, we was waiting that we would have gotten a COVID package. We're still hoping that with the current administration and stuff, because it is really hitting us financially. So we are still in discussion, and we are hoping to meet with the new administration very soon, and that we can see this way forward as to alleviate or give us a little ease on the current situation we have.
Okay, wonderful. So let me just go to Kentry Frederick, who is the first Vice President for the NCOPT, as we do our close. Just go through for us, once again, the agreements or the sort of conditions moving forward, coming out of the realization that we have 5 confirmed cases amongst your operators.
Very well, thank you very much. I just realized time flies quickly.
Yes, it does.
Yes, the present protocol that stands as far as minibus operators are concerned, there will be 3 persons per row of seat. The wearing of the mask, both by passengers and the operators or drivers, as you may say. The reduced talking during the commute, and the sanitizing of hands, both passengers and operators. The letter that was sent out is clear, and as Dimitri said, the National Council on Public Transportation must stand its grounds in terms of discipline and all of that. And it is the responsibility of the owner of the route permit, the driver of the route permit, the association's executive, to ensure that there are strict adherence to those protocols. Because we cannot be doing things as usual, because the implications we can see. And therefore, where there is blatant disregard for that, the Office of National Council will react. That may turn up as a result of that, the suspension of certain individuals from operating. If it means that at the ministry level, the permit can be suspended, it may get to the point of a driver's license being suspended likewise. Because if you don't have a driver's license, you cannot operate. You don't have, your route permit is operate, which means the number plate, the M plate, you have to return it to the office or park at your home. Or you can be struck off the route from operating. Because at the end of the day, you are doing something that you can't. So the Office of Council will react as long as there is non-compliance to those protocols.
And what sort of, as we're wrapping up, what sort of advice is the council giving to the members with regard to individual, personal, social life? Because we know that individuals, yes, you're at work, and the customary thing would be to meet up with some friends and say, Gasa, let's go fire one, so you have a drink somewhere, and that sort of. So how are you handling that with your members?
What we're saying, just like any other organization, suspend the social life for now. You are not making money on the road, and we know why you are not making the money, for no fault of yours. Why should you be socializing so extensively and putting the lives of persons at risk? We're not saying this to the minibus operators, because in the first place, you cannot be working and consuming intoxicating liquor. So which means you can't operate 6 or 7 hours without it. If you so choose to consume your liquor, You can simply inform the association that you are unable to work today, and as a result, go and sit by a tree and do your stuff. But we're not encouraging persons to do that. What we are saying that the members of the public, we are depending on you. Likewise, you are depending on the members of the public. So value for money, service for money, but there must be a balanced table. Because the government of St. Lucia, I'm not saying the United Workers' Party or the St. Lucia Labour Party or the People's Progressive Party, we must be fair at the office of NCOPT, the government of St. Lucia, whether it is the Ministry of Health, the Ministry of Transport, the Ministry of Education. They have been very supportive of the transportation sector. The police, sorry, Mr. Commissioner. The police have been very, very, very supportive of us. NEMO, I must say, even for the 2H Minibus Association, we recognize that they must commute after 9 p.m. and passes were granted in order to provide the service. So we are doing all we can, but we are requiring just this much, the protocols. Let us have the headache, do what you can do, so at least we get to save our nation from this virus.
All right, let me thank you so much, gentlemen, for coming through and giving us this important update. Members there of the National Council on Public Transportation, in the persons of the First Vice President, Mr. Kendry Frederick, Mr. Spencer McPhee, who's a trustee, and Mr. Demetrius Placey, the treasurer of that council. So just to give you a summation, 5 confirmed cases of operators there being affected by COVID-19. Unfortunately, we've had 1 death. Another is in critical care and another in serious condition. There are total number of 4 routes affected. And we did hear the members indicate that at least 2 members called in for today to say that they're not feeling very well, and tests are underway to ensure that these individuals are COVID-19 positive. So there's no reduction in the numbers of passengers being carried on the buses. So what you are being asked to do is to make sure you observe all the protocols. Sanitize before you enter the bus. Ensure that once you are seated, make sure that your mask is on, by the way, when you enter into the bus. Once you are seated, you are being asked to minimize on the talking, to make sure that you're not allowing any of the saliva, spit going all over the place, because we know that's one way of infection. So just minimize on the talking, or just no talking at all. And certainly the enforcement of the protocols, that's going to be heightened as well. And vaccination. Members of the NCOPT, they themselves have been able to get that vaccination drive going, and so we are very happy to hear that the members are definitely open to vaccination. Thank you so much for tuning into this special update. I just want to encourage you, as always, to continue to follow the protocols. Vaccinate, make that decision. Get yourself informed so that you can come to that decision of your own choosing and will, so that we are going to get ourselves back to some semblance of normalcy during this COVID period and hopefully post-COVID. I am Mr. Joseph. Thank you so much for watching.